Nearly 40% of Americans will be diagnosed with cancer at some point during their lifetime. All of us will know someone who has cancer. Cancer is notoriously difficult to cure, but recent scientific advances have greatly expanded our understanding of the disease, leading to changes in treatment that some call radical, even revolutionary.
Cancer is a process of cells that have abnormal growth and multiple cell divisions and grow abnormally in the body. In the 25 plus years that I've been a medical oncologist, I've seen the world go from a handful of drugs with limited benefit, with lots of side effects, to new drugs that are targeted agents specific for the tumor, based on personalized therapies, to immunotherapies based on ways we can activate the immune system that were never thought even possible less than a decade ago. And we have new drugs that are being tested not just in one cancer, but all tumor types. So for the first time in oncology, we say there's exceptional hope for patients where this hope did not exist before. 10 years ago, it used to cost about $1 million to take the DNA from the tumor cell and put it through a machine, and we read the DNA from left to right, and like a book, and be able to tell from the DNA exactly what genes, we call these oncogenes, or genes that drive cancer growth, were abnormal within the tumor cell. So $1 million for one person, and probably took about 6 months. Now, with the technology, we can do one patient in 7.2 seconds, and it'll cost several $1,000s, and the cost begins to drop every week of the year with new technology being advanced to accelerate the speed and to diminish the cost. Immunotherapy is the process by which we turn on the T cell. The T cell is the cancer-fighting cell of our immune system. On the T cell, there are actually what we call immune brakes. There are proteins that turn off our immunity. I think the most progress we've seen in medical oncology today, the one that really has outshone all other tumor types, has been in melanoma. So people question, why is it that melanoma responded more than others? Why has the success been so extraordinary in melanoma? It's the disease with the most mutations. And you ask them, why does it have the most mutations? The sun. And we know melanoma has many more mutations than lung cancer. And because of those mutations, the load, the volume, the density mutations, it is the most immunotherapy sensitive tumor type. For the first time, we have exceptional hope. The thing we have to get out is getting that message across, because the fear still exists. Cancer still carries tremendous fear. But I can say without a doubt that that fear is something we begin to have less of as we understand the possibilities that now exist in medical oncology. And that's been the transformation.